Idaho Matters podcast is brought to you by St. Luke's On Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on demand care for common ailments such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org. Idaho Matters is taking a deep dive into the loss of farmland here in the Gem State. Are you a farmer? What challenges do you face as farmland shrinks in Idaho? We want to hear your story. Email us at idahomatters@boisestate.edu or leave us a voicemail using the Talk to Us feature in the Boise State Public Radio app. And then listen to our series on farming called Land and Legacy. Episodes available on Monday afternoons in the Idaho Matters podcast feed. More Idaho Matters now from the studios of Boise State Public Radio News. I'm Gemma Cadet. They care for 40,000 patients every year, and they train new doctors, pharmacists, and psychologists in more than 30 rural areas all around Idaho. And now they're celebrating 50 years of caring for the community. We're talking about Full Circle Health. And we are lucky enough to have the president and CEO of Full Circle Health, Dr. Ted Epperly, joining us today to talk more. Dr. Epperly, so nice to have you back on the show.
Good afternoon, Gemma. Great to be with you.
So, Dr. Epperly, for those that might not be familiar, what is Full Circle Health and what role does it play in Idaho's healthcare system?
Great question. Full Circle Health is a clinical system of medical care, Gemma. We have 10 clinics that are located across the Treasure Valley in Boise and Nampa, Caldwell, Kuna. And in our clinics, we have primary care services, pharmacy services, mental and behavioral health care services. And not only do we provide clinical care to 40,000 plus patients that eventuate in about 200,000 patient visits every year in our clinics and in our hospitals that we care for, but we also have 16 medical education programs. So we have family medicine residency programs, pediatric residency programs. We have fellowships for additional training for physicians. We also have a pharmacy, psychology, and social work clinical training program as well. So as you can see, it's a complex healthcare system, seeing patients and educating future providers.
Full Circle Health, as I mentioned, is celebrating 50 years. Dr. Epperly, you've been serving Idaho for 5 decades. That is a milestone. How has the organization's mission evolved over that time?
Yes, the evolution of the mission has stayed very consistent in terms of both patient care and education. What's changed is the scope and scale of Full Circle Health. So we started out initially in 1975, 50 years ago, as just one single clinic location with only one educational program in family medicine. And over these 50 years, now we've gone to 10 clinic sites, 16 educational programs. Mission has stayed very consistent and very, very similar. It's just the scale and scope has increased.
Mm-hmm. And also, Dr. Epperly, one of the things that Full Circle Health really makes sure that happens is you ensure access to care for everyone, regardless of income or background. Can you talk a little bit about that and really why that is such a big part of your mission?
Absolutely, Gemma. Thank you for that. Yes, we are a federally qualified health center, very similar to Terry Riley. And what that means is that we are the safety net clinic system for our communities. We do that by having what's called a sliding fee schedule, which allows patients then, based on their income, to then have affordable and timely health care that they can afford. So depending on the percent of federal poverty level that people have, we have financial counselors right in the clinic, and we adjust the bill to meet their income so that for those that are making less than 100% of federal poverty, which is about $14,000 a year for an individual, or about $24,000 for a family of 4, their clinic visit would cost them only $10, Gemma. And in today's healthcare costs, that is astronomically low in regards to getting high quality, affordable, timely care for all sorts of medical problems. We value that service in our community. Many of us work at Full Circle Health or Terry Riley for just these reasons. We're able to then care for the rest of our communities that find it hard to be able to pay for quality health care. So that is one of the real advantages of a federally qualified health center, is the ability to use that sliding fee schedule to make all healthcare affordable to all people.
And Dr. Epperly, you mentioned Full Circle Health residency programs. I want to dig a little bit more into that because how important is education and training, not only to your mission, but really helping to shape Idaho's medical workforce? Because we definitely have, physician shortages here in Idaho.
That's very true, Gemma. Idaho ranks 50th out of 50 in terms of the number of physicians per capita. And that's only getting worse as Idaho grows. We become, depending on the poll you look at, anywhere from the first to the fourth fastest growing state in the United States. So we have a real mission here to educate that future workforce. We find that education and patient care go hand in hand. They're integrated. By being able to then afford all of these educational opportunities, it affords us the ability to take more patients to be seen. And by having more patients to be seen, it allows us to do a better education job with future physicians. So our two missions are interlinked and integrated in a way that it starts to solve both problems. It produces a physician workforce for a state that desperately needs it, and it provides patient care services to a community who also desperately needs it.
Healthcare has changed dramatically in the last 5 decades, Dr. Epperly. I am curious to know what are some of the biggest challenges that you have faced, and how has Full Circle Health adapted, I mean, to meet Idaho's evolving needs? I mean, you mentioned growth, of course, but I mean, there are other issues as well.
Yeah, that's very true. I think the biggest issue for most people is just the cost of healthcare. It's
Mm.
gotten astronomically expensive. And if a person does not have health insurance or is underinsured, then healthcare expense becomes the leading financial cause of bankruptcy in this country. So I think one of the biggest challenges is how do we make healthcare affordable to all people so that a person can live their healthiest and best life? Uh, all of us deserve that. All of us deserve to reach our full potential. So that I see that as being the biggest issue. The second challenge that I would say is that science and technology are changing very rapidly. So things are changing. New medications are introduced. New vaccines are developed. COVID-19 is a perfect example of the development in a year's time, a very effective vaccine that helps people prevent COVID and lessen the harm of that. Same with new technology. MRI scans, CAT scans, artificial intelligence in healthcare has become a huge deal now. And it, quite frankly, will help transform healthcare, I believe, in a very positive direction.
Reaching 50 years is no small feat. How is Full Circle Health celebrating this milestone? And Dr. Eppley, what does this mean for you? Not just as its CEO, but as a longtime family physician.
We're really proud of our 50th birthday, Gemma. We're going to have a 3-day celebration on the 23rd, 24th, and 25th of October. On the 23rd, we're bringing in a nationally and internationally known speaker who will speak on artificial intelligence in healthcare. His name is Dr. Robert Pearl. He was the former CEO of Kaiser Permanente Health System in California. He's now a full-time professor at Stanford University. And Dr. Pearl is going to come to the Egyptian Theater on Thursday, the 23rd, from 7 o'clock to 9 o'clock and speak to the community. That is open to the public. If the public would like to come to this event, there is a nominal charge of $10 for tickets, but the public would be welcome. And I'm very much looking forward to his talk on artificial intelligence and what he sees as a futurist in terms of how this will change day-to-day healthcare. On the next day, Friday, the 24th of October, we're going to have a golf tournament, a Full Circle Health golf tournament, as a bit of a fundraiser and a thank you to all the people of the community that support Full Circle Health. That evening, we're going to have an alumni event. We've had over 500 physicians graduate from Full
Wow.
Circle Health now over the last 50 years. 500 of them. So we're going to have an alumni event at the Boise Center on that Friday night. And then on Saturday, the big day, Gemma, which is the 25th of October, we're going to have a special event at the Boise Center, and we're going to have our 50-year celebration, our 50-year gala event. And we're very much looking forward to that. It's a way to say thank you to our employees, to all our graduates, to our community partners, St. Al's, St. Luke's, the WEMI, University of Washington, University of Idaho system, to Boise State, to Idaho State University, to ICOM, to Interpath Pathology. We've had so many supporters over the years, Gemma, and what a wonderful way to come together as a community and celebrate a big milestone like this 50th will be for us.
And Dr. Epperly, you have dedicated your career to improving community health. What keeps you inspired in this work day after day?
Oh, that's a wonderful question. I think at the bottom of all of that, Gemma, is I care. I care about our community. I care about the citizens of our community. It matters to me that we're making differences and educating wonderful physicians, psychologists, pharmacists, and social workers that will help people with their problems. That matters to me. And to care for the community and all of the community to make sure that they have a leg up in terms of getting healthcare problems solved. That matters to me. So I think day after day, I'm living our mission. I valued the educational aspects of what we do here at Full Circle Health, and I very much love the patient care we provide.
Well, Dr. Epperly, we are so lucky to have you on Full Circle Health in our community. So thank you for everything you and your organization does.
Thank you, Gemma. It's been an honor to be with you this afternoon.
We've been speaking with Full Circle Health President and CEO, Dr. Ted Epperly, talking about Full Circle Health as it celebrates 50 years. And of course, that event at the Egyptian Theater in Boise on October 23rd is open to the public. It is from 7 to 9 p.m. You've been listening to Idaho Matters from Boise State Public Radio. I'm Gemma Gaudette.
Sources and methods, the crown jewels of the intelligence community. Shorthand for how do we know what's real? Who told us? If you have those answers, you're on the inside, and NPR wants to bring you there. From the Pentagon to the State Department to spy agencies, listen to understand what's really happening and what it means for you. Sources and Methods, the new national security podcast from NPR.